So what are the latest non-surgical treatment for premature ejaculation? The most common sexual problem in men is premature ejaculation, which means men ejaculate too soon than they wanted. So, as per the International Society of Sexual Medicine, that is ISSM, there are two classifications. The first is the lifelong, and the second is the acquired premature ejaculation. In the lifelong premature ejaculation, so this early ejaculation is there since the time the man started masturbating or sexually active. So he's never seen a normal ejaculatory time. So that's lifelong. Acquired premature ejaculation means a person was quite okay, he was doing well for few years, and then suddenly after few years he started developing a premature ejaculation. So that's called acquired premature ejaculation. So to give a time duration, anything less than 1 minute in lifelong premature ejaculation is abnormal. Anything less than 3 minutes in acquired premature ejaculation is abnormal. So that's the definitions of the International Society for Sexual Medicine. So as the first line therapies, we suggest creams, sprays and tablets. So are there any newer therapies that have come in? Yeah, so the two newer therapies that have come in is, one is the Botox injection to the bulbospongiosus muscle. Second is the glans augmentation or the glans fillers. So how do these two things work? So the glans augmentation is basically we give the filler injections, that is the hyaluronic acid injection, it is given to the glans. So how does this help? So this fillers which is given to the glans, this forms a barrier between the outer layer of the glans and the nerve endings, thereby reducing the sensation. So that's how these fillers work, and it also reduces the tactile sensitivity of the glands, thereby helping in the premature ejaculation. And usually we give around 2 ml of the fillers, sometimes maybe 4 ml is required depending on how big the glans penis is. And very rarely some bruising can happen, but that's quite rare. And not everybody responds to this. There are maybe, again, this is still in the evolutionary phase, but it's worth a try since it's a non-surgical option. The second is the Botox injection. You would have heard of Botox injections being given on the face and also in the urinary system. Botox injection has also been tried in premature ejaculation. Again, these are still preliminary results. What is basically done is that Botox injection is given to the bulbospongiosus muscle on the either side of the urethra. So again, different people follow different techniques. We usually give around 50 units of the Botox injection, and when we take the vial, we usually dilute that with 6 ml saline or sometimes 10 ml saline, depending on how thick or big the bulbospongiosus muscle is. We inject, for example, if we take 6 ml saline with the Botox 50 units, we inject 3 ml on the one side and the 3 ml on the other side of the urethra, that is into the bulbospongiosus muscle. Patients may start noticing changes in usually by around 10 days. And as we all know, the Botox effect may last in some for 6 months, some for 9 months, and for some for up to 1 year. So what this Botox does is basically it relaxes the bulbospongiosus muscle, which is one of the main muscles in the ejaculatory phase. And also it inhibits the acetylcholine neurotransmitter, which is involved in the contraction of this muscle. Botox may help. Again, all these are still in the research phase, but we do see men quoting significant improvements after the Botox injection. So if you're tired of taking sprays, creams, tablets, so here is the time that if you want to explore the options of Botox or the glans filler, so please do consult an experienced andrologist for the same.